Welcome everyone to a webinar on UltraClear skin rejuvenation with Belle Vie plastic surgery. Are you ready to achieve smoother, brighter, more radiant skin? Well, today Dr. Sheck and our amazing esthetician Amy are going to educate you about our brand new laser UltraClear, everything it can do and how it might be able to support your needs. Before I hand it over, let me introduce our speakers. So Dr. Sheck, if you don't know him, he's a double board certified plastic surgeon. He recently relocated back to Wilmington area because he has tons of family here, and he's very grateful to join the amazing team that Dr. Church has put together. He brings over 8 years of surgical training, and he has a very strong passion for education and commitment to providing really individualized, holistic plans for every single one of his patients. And then we have Amy here. She's our amazing licensed esthetician. She's a true Wilmington native. She attended East Carolina and has grown up here her whole life. Fun fact, she also worked at a ski resort in Vermont in her 20s, which I am jealous about. But Amy has been an esthetician for over 13 years, so she has a lot of knowledge to bring to the table. And between the Dr. Sheck and Amy, we hope to share with you guys everything we know about UltraClear. So, Dr. Sheck, Amy, the floor is yours.
Thanks so much. I appreciate it. Thank you for the introduction. Thank everybody for joining us. My name is Casey Sheck. I'm one of the plastic surgeons here at Belle Vie in Wilmington. I do, let's say, 98% of any of the surgery above the collarbone here at Belle Vie. And I was brought here to really advance the facelift, neck lift, upper lower eyelid, whole facial rejuvenation program, not only for La Belle Vie, but for Wilmington in general. There's a huge need, and I think we are filling that with spades. We've been really bringing in the best that we can in the entire country as far as talent, as far as training, and now with the UltraClear, we're really bringing everything full circle with the last gap we had, and that's for skin resurfacing. Like we said, I do a ton of face and neck lifts, upper and lower eyelids, and a lot of my patients require not only surgery, but really the icing on the cake is making sure that your skin is as good as possible, whether that be before surgery, during, or after. We have an entire team here really focused on bringing you the best options possible. Amy is integral to this for me. I don't think I'd be able to do a third of the patients that I do without having Amy and also our injector Leslie here to really help really polish up everybody's results, like I said, before, during, and after. And UltraClear is unbelievably important to that. This is one of the newest, and it's the newest, but one, in my personal opinion, one of the best lasers on the market. We'll go into it a little bit more about exactly what it does. But as someone that has published multiple papers on laser resurfacing and pioneering new ways to get you back into your day-to-day life a lot faster using these high energy devices, I'm really impressed with what we can do with it so far, and I can only tell you it's getting better and better by the day. I would love for Amy to tell just a little bit of her experience recently with it and introduce herself.
Hi, my name is Amy Williams. I am the esthetician here at La Belle Vie, and I am super excited to be working with this laser. I've worked with other lasers over my career, and it's so nice because you can really pinpoint things. When I ask a patient, what bothers you? Okay, well, we're going to really focus on this, but while we're there, let's smooth everything out. Let's work on the little things that maybe don't bother you quite as much. So you just get a lot of
you really get a lot of personalization and individualization of the treatment plans. I think it's amazing how personalized we can make this. Whereas with something like I tell everybody, this is not only the hammer and chisel, but it's also the paintbrush. Whereas I've worked extensively with CO2 lasers in the past, which I think are amazing for their very limited use, but they're a hammer and chisel, and this really gives us the chance to really paint on top of all of that. We're going to move forward, and so this is a little bit of a video that just gives a little bit of an explanation of why UltraClear is different and what it's really bringing to the table. And we will go ahead and let this play for a minute, and then we'll give you guys a lot of information after this.
The first of its kind, cold ablative fiber laser solution. The first device to give new life to all skin types. Finally, a way to treat every single patient. UltraClear, the first safe solution for sensitive skin, especially skin of color. Optimized to individual needs, balancing cold and thermal energy at the optimal wavelength. Ablative resurfacing and 3D collagen remodeling in one pass, delivering each pulse to the exact depth with precise timing, minimizing risk and pain, allowing faster healing with optimal results, keeping patients safe from discomfort and side effects, something they can count on every time, no matter what. Letting them get back to their day quickly and making sure they feel amazing when they leave. Be the first and move your practice forward. UltraClear, the clear choice to reverse the signs of aging for all skin types.
So one of the things that I love about the UltraClear is what we're addressing. We're not just looking at tone or texture or fine lines or deep lines or acne scars or surgical scars. We're not just looking at pigmentation. We're looking at all of it. And we're able to address that in a bunch of patients that normally wouldn't really be able to be addressed.
The laser is an all-in-one solution. So if you have pigmentation, fine lines, scarring, we can treat all of them. It's super versatile, it's quick, it's convenient. That's why we love it. That's why our patients have been super happy with all of the results. We treat multiple things all at once. You're in and out and moving forward.
And one of the most important things that I think is great is, for a long time, if you had a darker skin pigmentation, the way we look at this is in the Fitzpatrick scale, type 1 all the way up to type 6. It's essentially how dark is your skin, and the reason why is melanocytes or melanin. You've heard that word before. Melanin gives you the darkness to your skin. The problem is melanin doesn't evenly distribute in your skin, especially with any type of heat therapy, anything that puts energy into your skin, any kind of trauma. Patients that are type 1, 2, and even 3 have the world as their oyster. They can really use just about any kind of skin treatments. 3s, 4s, 5s, really difficult. 6s, the darker you are, you really run the risk of having some really bad pigmentation changes. And UltraClear's really opened the door for us to really be able to treat all types of pigmented skin. I think that's really important because a lot of people don't even realize that they're putting themselves at risk when you're using some of these bigger energy devices for having those pigment changes. And here, we're going to tell you about all of your risks, but luckily with UltraClear, we have a lot more options for you now.
So this is a diagram of your skin. Many of you have probably never seen this before. So the 3D Miracle, we're doing that top layer, texture, pore size. Then we're going all the way down to laser coring. That's where you're going to start getting that collagen remodeling, that rebuilding that we're losing over time, and everything in between. So that's just showing versatility once again of this laser and how we can target individual areas.
Just like Amy said, we're looking at the different things. 3D Miracle being a very superficial treatment. Downtime is minimal, but that's for different patients. If you're in that 3, 4, 5, you're not going to have the redness like some of our really fair skin patients, or if you have very sensitive skin. We've treated patients that the next day look amazing or going on about their day. And sometimes you're going to have 2 or 3 days of a little bit of redness until some of that pigment and that granularity of your skin really starts to slough off. And then you're glowing. You have an amazing look. I tell everybody that 3D Miracle is essentially like the best exfoliant that you can never do. You can't do it, but this can really do it. We're moving down into our moderate levels, our Clear Plus, our Ultras, our UltraClears. These are moving down that layer, like Amy was showing you, going deeper in your skin, addressing things that we're losing over time with aging, with sun exposure, with weight loss. A lot of this is what we're really addressing, and then going down to our deepest layer. Our UltraClears are customized laser coring. We use all of these together for most of our patients to really give you the best results possible. I'm really happy to tell you that a lot of people that we've been treating in the past with some of our bigger energy devices, our CO2 lasers, our erbium yags, all of these things that you've heard on the internet, those people have downtimes of 10, 14 days where you're crusting and bleeding. And honestly, you look like you've been burned, because you are. We're burning you with a very professional level of care and comfort. However, you're taking 14 days out of your life to get the result. Now we're getting that down to 5 to 6 days. And then sometimes we can get it even less than that. And we're going to talk to you about all of the different options we have and show you real life patients before and afters.
So this is an example of how the laser actually works. The red arrows show,
Go ahead.
sorry, the red arrows are showing the heat that is being drilled down into your skin. The nice thing about this is that it is a cold fiber laser. So heat that is cooling your skin, then heat that is cooling your skin. That's helping with the recovery time, is helping with making you more comfortable during the laser, and it just gives overall better results in general.
I think this is one of the most important things with this laser is how fast this light is getting in and out of your skin. You're really seeing a difference compared to things that are getting in 4 or 5 times a second, or even 30 or 40 times a second. We're getting into the 1,500 times a second and really being able to tailor it to you instead of one size fits all. And I don't love that. The UltraClear laser itself, this is what a treatment looks like. We're going to skip through it a little bit. But one of the things that you're going to see here is we essentially individually pick your treatments, and your safety is our most important thing. Anyone that's ever met me for a surgical consult, I tell you, number one is safety. Whatever is safest for you is what we're going to talk about here. We're going to protect your eyes, because as we get closer and closer to your eyes, we're going to make sure we don't get any of that energy delivered onto the cornea, onto the sclera, anything like that of the actual eyeball itself. Now, what that means is we have a bunch of options. You can see here that you're seeing that kind of like frosty look of those circles. We can make that into 1 ring where it looks like that. We can go 2 rings where it's even wider. We can do 3 and really paint that whole surface. However, not every treatment looks exactly like this. And I think that's really important for patients to know. Sometimes it is important to leave gaps in between of the treated areas, and that this laser is a fractionated laser, meaning we are treating fractional areas. The fraction's treated and a fraction that's not. The fraction that is not treated is allowing that healthy skin to send stem cells and healing properties to the areas that are being treated. That's really getting you bouncing back a lot faster. You can see this patient's getting treated all over her face with topical numbing only, and she's not moving at all. We can get right up to your hair follicles without damaging them, and we can get really close to that lash line on your eyes. If I'm doing something in the operating room where you're asleep and I put corneal protectors where we put like a big heavy metal contact in your eye, I can get right up to that lash line and really treat every last millimeter of your upper and lower eyelid to give you the best option possible. What this video is really showing, I think the most important thing is this patient's feeling essentially no pain. I can tell you this personally, I've had it. My wife has been treated, Amy's been treated, our entire office staff has. That way they can tell you personally what it feels like. It's hot. After a bunch of treatments, you're gonna feel a little hot afterwards. However, day 1, we call everybody on the first round of treatments, 0 pain, a little bit of tightness, and they're just a little annoyed because every time they move their mouth, they're feeling everything's a little tight. That's fine. That's good. That's what we want. That goes away, but your skin results, they don't. They keep getting better. We're going to start talking about like the different levels. This is this 3D miracle, and then the clear treatments. These are those superficial levels that are going to be doing the 0 day, 1 day, maybe 2.5 day downtime, where downtime doesn't mean you're not going out in public. It doesn't mean that you're hurting. It doesn't mean you're not doing things. It means that you're still a little red. You still look like you had something done to your face, but everybody's going to be different on this. But these results are amazing. 1 treatment for most of these, and you're seeing that pigmentation and texture really change in a couple weeks, which is unheard of. Look at this patient that has not only a lot of deep lines and wrinkles that if she wanted to have a downtime of 5 to 6 days, we can treat those. She said, no, I don't want that. I want to make sure that I am back out in public in about 4 to 5, like 4 days, no makeup, no anything. And this is what 1 month after one treatment looks like. Look at the pigmentation and look at the texture on her face. This is not a surgical result. This is not an ablative laser result. This is something that takes about 15 to 30 minutes here with no numbing, no pain, and a little bit of heat afterwards, and you're getting results that look like this.
This is an amazing example of a young patient in her 20s. Her skin looked a little dull. Now she has that nice radiance. She had a little bit of pigmentation. That's significantly lessened, but it's just that nice glow where people are like, oh, what you look really well, and what have you done?
I tell everybody water and sleep. Just tell them that and they'll believe most of it. Patient like this, now we're getting slightly older, but a lot of sun damage. We all have lots of family, friends, probably us, that look like this, especially in the Wilmington area after our prolonged summer exposure. That sun damage isn't good. You don't want to keep it on your face. It builds over time. And by doing this, I think one of the things that's going to catch on, especially in our practice with our patients that I've known for the last year and a half already, every 3 to 4 months, having a package where you come in and get treated, that you have minimal downtime and your skin looks this good 1 month after one treatment, you're going to come back for that. And I think it's something with a 30-minute visit to Amy, it's unbelievably comfortable, very, very little pain and little downtime. This is something that a lot of people are really going to want, and I'm really excited to be able to provide it to everybody.
This is a fantastic example of the texture on her skin. It's 1 month, one treatment, and it's only continued to get better. Her skin looked dull, but she also had pore size, just some texture issues, and that is totally cleared up. Like I said, it's going to continue to get better over the next, several weeks, few months. Once it starts to level out, she can come back in, get another treatment in and out during lunchtime, and a day or two of downtime. Maybe people think you just went to the gym.
Yeah.
And then you're, like I said, moving on with life.
Yeah, I think someone like this that has just a little bit more color to their skin, and that fits 2 and 3 groups, you're going to have a lot less downtime than the really fair skin patients or people that are unbelievably sensitive. And if you want to keep it even lower downtime, stick to just the face instead of adding the neck on. The neck stays a little bit redder. Our necks are always a little bit more sensitive. Anybody that gets hives when they get nervous or get angry, you're going to see that. That's going to be a little bit more sensitive. Here, a day out with a little bit darker skin, you're looking amazing and moving on about your life. Now, this is a neck. Now, most people don't look at necks like this because nowadays everybody's down looking at a computer screen or a cell phone in their lap and no one talks to each other, and you're getting that tech neck. Earlier in life, you're seeing these deeper lines and wrinkles. Patients that are out in the sun, you're reading a book on the beach when you can, which is awesome. I'm not hating on that. I like that idea. However, you're seeing things like this, chronic lines with different texture changes and a lot of pigment changes. This is just 5 weeks after one treatment of the lightest setting that we have. This is an amazing difference from someone who looks at necks probably 5 or 6 times a day when I'm here in the office, people coming in for either consults or post-operative for my neck lifts. This is one of the best things that I tell people about. I think either during surgery or after surgery or before surgery, or whether you want it or not, getting the pigmentation and those fine lines and wrinkles changed is amazing. And this is a game changer. This is really getting a very limited downtime with a really good result. This is no longer what people are looking at. They're not looking at that white line going across your neck. It's gone. A little bit of that crepey skin starting to go away. A lot of those deeper lines starting to go away. And they stop looking at that and they look you in the eyes instead of looking at your neck. And I think that that's an unbelievably important thing that we don't really talk about a lot.
This is an example of, we were talking about our Fitzpatrick's earlier. This is an Asian patient that was able to be treated. Her texture, maybe some acne scarring on her cheeks, that still lovely glow that everybody gets. The lines on the corner of her mouth, a little softened up, but she just limited downtime with great results, and it's fantastic for Hispanics Asians, people like that who have always been told they can't have laser scoops because we can burn you. Now you can.
This is anyone that's been to our office. This is our amazing office manager, Andrea, who we yelled at her not to smile on photos. This is not her fault. We told her not to do it. So she is unbelievably sensitive to anything, light peels, any kind of retinoic acids, tretinoins, everything. Her skin's going to get really, really red. We treated her with the clear, which is not necessarily the 3D Miracle. It's a little bit deeper than that. She wanted to really exfoliate. She hasn't had a treatment in a while. This is immediately after. This is about 3 hours after the treatment. By this time, she was having no pain. She was just very red. This is about 18 hours afterwards. It's the next morning. Starting to get a little red and scabby, and then things start to come off at that kind of 36-hour mark. By day 3, she woke up and said, I could put some makeup on this and make it disappear. And then over here is looking great at day 4. This is someone who I love these photos because it shows patients that are very sensitive. We're not ignorant to the fact that you're not going to be the 0 downtime patients. However, you can get this and still go out and about. She came in with a little bit of tinted SPF on, and no one knew she had anything going on. And then all of a sudden, 5 days later, her skin is glowing and looking amazing. I think it's really important to be realistic about your downtime. We're not promising the moon, and we're not promising you're not going to have any, but I think we can really get those downtimes down a lot.
Once again, an amazing result from darker skin African American. Her skin is absolutely beautiful, but that pore size on her nose, the cheeks, it just sloughs off all of that dead skin that we are all carrying around. The pigmentation up on her hairline has lessened, and she just has gorgeous glowing skin. This was after 3 treatments. With darker skin tones, we do have to do, we have to change everything. We cannot go as aggressive. So you're going to have multiple treatments, but you're going to get there. And that's sometimes we're doing that marathon. We're not doing a sprint, but for lovely glowing skin that's going to be healthy, it's worth taking some time.
And then going slightly deeper on patients with these chronic discolorations, this keeps a lot of people from feeling really comfortable about themselves in public. And you can see after 2 treatments, it's almost completely gone. The most people looking at this patient in public would never even notice that there was anything there. But looking at what they looked at before, this is really important. This is really adding a lot of options, and especially someone with a little bit more pigmentation to their skin, we're really able to soften that out and make sure you have great results across the board.
This is after 2 treatments, 10 months. Huge amount of pigmentation that was on her skin. When we're doing treatments like this with pigmentation, a lot of the times we'll take off that top layer, but then there's melanocytes that get pigment come up to the top. So then we have to wipe away some more. I didn't have this spot before. Let's clear it away. So this is 2 treatments. Got that top layer off, more came to the surface, so it's probably swept away. Easily do a 3rd treatment, but it's her expectation. She may have been like, I need 85% improvement, and I'm happy to go.
One of the most important things that I think a lot of people overlook, and we were talking about this earlier today and yesterday, a lot of people that keep up with social media and the plastics trends and everything else, everyone has seen Kris Kardashian's facelift, but no one has seen her hands. She wears gloves when she goes out in public for high value photo ops. And this is the reason. Our hands age worse than our face, and people really neglect them. The reason why? It's because we neglect them while we age. We very rarely remember to put the sunscreen on the backside of our hand. We forget to moisturize the backside of our hands. And these are in the sun all the time. The pigmentation changes just from a clear treatment, 3 treatments out, 5 months afterwards, is amazing. Now, I would postulate, honestly, for some of the patients that we've even done and we're moving forward with now, this is awesome. You want to see the best result possible? Come and see Amy to get your hand treated like this. And then once that's done, go see our injector, Leslie, and have her do a little bit of filling in there. If you have some area of extra fat that you want removed on your abdomen or your flanks, I'm more than happy to remove it for you, but I'd highly recommend injecting it into your hands and making sure we hit you with the laser at the same time, because that is going to get rid of the volumization problem, and the skin treatment is going to be taken care of by the UltraClear laser. You're going to have an amazing result. Not only can we make sure that your face is looking amazing, but we can also make sure that your hands match your face. And I think that's really important. We're going to move on to some of our deeper treatments. These are people that are in the moderate treatment range. They are going to be a downtime of anywhere between 4 to 6 days. Even our deeper treatments now, in my hands and in Amy's hands, we're getting you into that 5 to 6 range day downtime. And this is a real downtime. This is not the you're a little red, you can cover it up. This is a little bit of scabbing and crusting. However, as someone who's extensively used CO2 laser and published on it, most of those patients would be down for 10 to 14 days until you get all of that scabbing off. We don't want you to pick. All of my pickers out there, you know who you are. We've talked about this. Stop picking. I would love to do it too, but you have to stop. The scabs are there for a reason. They're healing from those the deep treatment up to the superficial. But these results are really amazing, especially because it's 3 to 5 days of downtime of that scabbing and it's going away. We're doing things like scar treatments. 2 months after a second treatment of the scars, you're seeing not only the change in the pigmentation of the scar, meeting more of it around it, but getting it thicker. We're raising up that bed. We're making sure that it has more vascularity in there and there's more collagen. And this is no longer noticeable at first glance. And for a lot of people, on their face, on their neck, on their hands, on their arms and legs, this is really, really important. And I'm elated to be able to offer this to people. Amy's been doing it already. And we're seeing some preliminary amazing results. And don't worry, we will be spamming your Instagram and TikTok and Facebook with it as soon as we have patients that agree to share their photos, which is the most important thing. Privacy is always king. However, you're going to be seeing a lot of this from us in the future.
This is a great example of a patient a little older. She's no longer in her 20s and 30s, but after one treatment, all that heavy pigmentation has gone away. Those heavier lines, those nasal labials have softened. Forehead, nice and glowy. We're treating from the inside out once we start getting into some of these deeper laser treatments that we can do.
And this is one treatment. This is not a series. Everyone else is going to tell you, oh, with CO2 laser, we need to start light and then do a little bit more and then do a little bit more. And then on your 4th treatment, we'll really get after it. This is one treatment and these are the results you're getting. When we're telling people you need a series of treatments, this isn't what you're looking like when you're done. You're getting an amazing result from things like this. One treatment, I think this is amazing. Patients that come in and go, I don't want surgery. I just want a little bit of refinement. I have some deep lines here that I don't love. I'm a little loose. I got a little bit of sagging. What can we do about this? Now, in my hands personally, I think that lower eyelid looks amazing. I think this is also unbelievably overlooked by a lot of patients, and especially men. Any of the ladies that are out there tonight, maybe this is the perfect time to talk about a Christmas gift for your dad or your husband or your brother, or your son or whoever that doesn't like those lower eyelid lines and wrinkles, that doesn't have a lot of bagging to their lower eyelids, but it's just the wrinkles and creases that they don't love. This is one treatment. This is amazing. I tell everybody, plan on 2 treatments this year. If you do it in the winter time, that's amazing. Maybe a touch up a year from now. But this area is something that really bugs a lot of people, and we can get a great non-surgical result in very little downtime and really make you feel a lot better about yourself. And this is one of those things that I've already had some of my own patients be like, I'm dragging my husband into my follow-up, and you're going to talk to him about this. So it's one of those that goes men and women, everybody, but the guys really refuse to talk about it. They want to talk about it.
This is an example of a patient who had heavy scarring, most likely from acne. So with one treatment, and that is only 20 days out, pigmentation right above the scarring gone. The scarring has released. It's a lot softer. I think it's an amazing result, and it just goes to show we're not only doing fine lines, wrinkles, we're doing acne, scarring, pigmentation, lots of different things. Once again, all at the same time. Amazing, versatile thing.
Probably my number one thing that people come to see me about above the collarbone is their neck and lower face. I unfortunately have a handful of patients that are not surgical candidates, whether it be from other comorbidities, they've had a recent heart attack, they've had adverse effects from anesthesia, or they just don't want it. And I completely agree with that. I'm not here to tell you you have to do anything. However, people that don't want their necks to be the first thing that people look at, we have an option now that is not surgical. This is not a surgical result. You still have some of the banding here for people that have seen me before. I talked to you, this is your edge of your platysma muscle that's supposed to be covering your entire neck. It unbuttons like a button-down shirt from the bottom up. And it starts in our 30s. And by the time it reaches up here and starts to separate out, you're getting these bands of your of your neck all the way down. And when you look from the side, that's what people talk about, the turkey neck. Well, some people don't really care about that as much as they care about the deep lines and wrinkles and some of the folding over of the lower areas of those folds. This is after 3 treatments. And I want to point that out. This is 3 treatments. This is not 1 treatment. And we'll talk to you about that. We'll give you realistic expectations. We're not selling you snake oil. This is real results. But it takes a couple treatments. These treatments are great. This is skin tightening that you may never get with any other kind of treatment, that gets rid of this being the first thing that people look at when you talk to them. Now they're looking you in the eyes. You feel better about yourself in photos. You look better. You feel better. It's important. And I think a lot of people really appreciate that at the end of the day.
This is another example of Darker Fitzpatrick. Still has those acne scars, just, not good texture, larger pores on her nose, lower half of her face, such a huge improvement. And it's that nice glow. Like I said, it's the overall texture of her face greatly improved.
This is, I would say, 25% of the patients we see on a daily basis have been doing a lot. They're trying to keep up on their skincare routine. They love the way they look overall, but they've really noticed a little bit of dullness. They're noticing these lines are starting to get deeper. And what that's coming from is that thick layer of your skin, your dermis. As we age, we're losing a lot of the elastin and the spring and the collagen to that. We're not springing back as much as we did. And then we're adding on year after year after year sun damage and discoloration. Getting rid of that discoloration alone would be more than enough for this patient that most people would be super happy. But starting to see these secondary banding, these secondary fold lines on the marionettes, and really seeing in our preauricular, right in front of the ear, these deeper lines that are starting to show up. All of a sudden, after 1 treatment, your skin looks this great and glowy, and you're getting that tightening and your jawline looks that much better. I mean, a lot of people, this is all they really want. And I think that that's appropriate, especially if this person in 5 or 10 years is going to need a facelift or a neck lift. I would love for you to come in every 2 years and get a really good treatment with Amy. That way, when it does come time to needing surgery, your result is going to be so much better, so much faster, because your skin is as healthy as it possibly can be. It's going to bounce back and really hold the shape that I give you. You guys are really going to love that.
I adore this. This could be her 20 years earlier. All these fine lines, the wrinkles, the smoker's lines around her mouth lessened, pigmentation gone, her under eyes, she looks well rested. I mean, it's 3 treatments. Once again, we're not saying it's a one and done. If you're willing to put in the time and the effort, you're going to get amazing results.
Yeah, I agree. I think really talking to our patients about this is something that, I mean, don't take my word for it. Look at all of our reviews, read them. We take an inordinate amount of time with every one of our patients. And the reason is we think you deserve it. We think that it's not your job to understand the ins and outs of plastic surgery, skincare, aesthetics, laser treatments. It's not your job. It's our job to teach you. And you could close your eyes and click on any result or any review from myself or Amy or Dr. Church or Leslie or anyone here. We're going to make sure that you understand what you're going through, what your risks are, what your benefits are, and what we can really do. And we're going to make sure we listen to you too, because I think that's one of the most important things. Most importantly, we're going to keep you safe. However, we're always going to make sure you get a result that you really like. And I think almost all of you are going to love it. And that's what I love about UltraClear. It gives us the options to really tailor this for everyone. Talking about laser coring is adding that extra layer to those deeper treatments. What laser coring is really going to do is, and I'll show you a video about this. Laser coring is something that is new on the market. It is unbelievably exclusive to UltraClear. There are people that do laser or do coring that use needles to take chunks of tissue out of your face, neck, other areas. The problem with that is bleeding, scarring, downtime, and I don't love the results. What this does is shoots that laser unbelievably quickly in a very staircase or a rosette fashion. So as it heals, it collapses down on itself. And we're getting 1, 2, 3, 4, 5, 6% loss of surface area to really tighten. We can do that in vectors. We can do it on your forehead to do a surgical, a non-incisional brow lift. We can do it along your jawline. We can do it on your neck. And we do it on almost every single one of our aggressive treatment patients at one place or another, along with 3 or 4 other different settings to make sure that you are getting the result that you deserve, that is very, very dedicated and very individualized to you. And I think that this laser is really adding a lot to our armamentarium of giving you what you need, not just what we have. And unfortunately, a lot of people are treating people with the hammer nail syndrome, which is what, if you've visited me before, I'll talk about it ad nauseum. Certain people don't have all of the tools at their disposal. Amy is an amazing esthetician because she is amazing at what she does, but she also knows that she has Leslie, one of the world-class injectors, 2 doors down, that we can do any type of volumization and neurotoxin procedures that you need. She has myself and Dr. Church, who have years of experience treating the face, neck, body, everywhere that we need, that we don't need to sell you something that you don't need. We are not just a hammer and you're not just a nail. We can make sure we're treating every facet of this and in the appropriate timing with the appropriate volume and the appropriate results that you're going to be unbelievably happy. And not everybody can really do that.
And we all speak to each other. It's not Leslie's like, what are your plans for this patient? Well, okay, I'm going to hold off on this so that we can do this. And let's bring Dr. Church or Dr. Sheck in. And we are a team when we say that you see us. You see all of us, we work together.
And I think at least 2 or 3 times a week, if not more, we will powwow and sit down and be like, all right, I have a patient that I need all of you to see. It's going to be about this. This is what I can do personally. However, I don't think they're going to be happy with it until we get them to a better place with their skin texture, or whether there's a laser treatment, or whether we need some neurotoxin on board to really see how, if we can get away without doing surgery. Can I get you a result that you're going to be happy with without surgery? I'm more than happy to not operate on you. I like to say that I'm a good person, a very good surgeon, and a very bad businessman. I want to make sure that I can do as little as possible to make you as happy as possible. And having a world-class team that covers all of this is very rare. However, we have it here and we're really bringing you results like this lady that Amy's going to talk a little bit about.
Yes, she's our lighter, brighter, tighter. She looks so much younger. Everything on her face is lifted. Her pigmentation has gone. She looks more awake. This is after one treatment. Is it after one pass of the laser? Absolutely not. We have done multiple passes on multiple settings and multiple areas, but she looks like a younger self. She has hopped in a time machine and woke up one morning and goes, God, I feel better.
Yeah, and I think that's what my goal is from a surgical standpoint. It's really hard to do that with just lasers, and we're seeing that more and more every day of patients going, people ask me all the time, what did I have done? And I tell everybody, a little bit of sleep and a whole lot of hydration. You can tell them what you want, but otherwise, if you stick with that, some people will believe you. Looking here, like I said, I do 100 neck lifts a year. This is a good result. This is not a surgical neck lift result, but that's not what everybody needs or wants. Certain people come in and go, I was happy the way I looked when I was 70. I'm 75 now. I don't love the way my skin looks. And this is how we can get you back 5 years. We can get you where your skin texture is better, that you aren't seeing kind of the fold on the fold move. You're not seeing deeper lines on superficial lines on deeper lines. This is really helping that. This is one treatment. This person after 2 or 3 treatments is going to be she's happy already, but Dr. Peck did an amazing example of this. I will address something that every discerning person watching this should really look at. These are not all of our photos. This is not, I'm not claiming these are ours, but these are all UltraClear results. We had recently got the UltraClear. Some of you that are maybe on here, some of you may have not, or be watching it afterwards, may already be our patients that have had treatments. We need patients to agree that we can show their photos. Safety is number 1, privacy is number 2, and results are number 3. And I think that in the months coming, you guys are going to get hopefully not bored of us showing you amazing results with the UltraClear, but patients are already amazingly happy with just the downtime. Over the last kind of 6 weeks, we've really been ramping up the usage. We're booking out kind of days to weeks to months, and it's getting faster and faster for these. But we have a lot of openings with Amy coming up, and myself for surgeries in the next couple months. You're going to be seeing a lot of these photos, but I don't want to be the person that's telling you these are mine. We put these here to show you who did these, but they're not doing anything revolutionary. The treatment is the revolutionary part, and we're going to make sure that we show you a lot of those coming up soon.
This is one of my favorites. I show her all the time. Older patient. So many of my patients. I don't like perioral. I don't like the lines around my mouth. Everything is softer. Her skin is smoother. You don't notice the lines as much because the pigmentation has cleared out. So it's just a good all over, like, once again, she looks younger around her mouth. It looks like somebody took an eraser to her.
Yeah, we're seeing a lot of patients now coming in and bringing in photos and AIing themselves to tell us what they want to look like and what they need. I love that. AI doesn't have a bioengineering component of it, so some of it's not possible. Some of it we can make it even better than what they're talking about, but we will talk to all of you about this. One of my favorite things to talk about for people is the perioral lines, or the fine lines around your mouth, the smoker's lines. I hear it every single day. I never smoked. I have smoker's lines. My mother looked like this and she smoked, and I chose not to smoke, and I still ended up like this. It's a very difficult place. Around your mouth is always moving. Even when you're sleeping, your mouth's opening, you're breathing, you're moving, you're talking, you're chewing. All of that is never going to stop moving. The skin, the thickest layer of your skin is getting thinner and thinner and thinner as we age, and you're going to see those lines getting deeper and deeper. I've been invited to speak around the country for luckily because of some of my mentors that have taught me some amazing things. I've published some amazing papers on research on perioral rejuvenation specifically. This is a very good result. With this person, if she came in to see me, this is one treatment. I love that. I've actually used some of the same protocols that Dr. Peck has used for this. We've turned them up just a little bit, and we're adding a couple more passes, but what I'm adding personally is myself and Amy together. When it gets to this point, if you come in and you look like the person on the left, you're going to see both of us, because what's going to happen is I'm going to take a little bit of fat from you somewhere in the belly, upper belly, lower belly, a little bit on the flanks, a little bit on the middle thighs. And I know everybody's next statement, you're saying it back there behind your computer screen. You're saying, Doc, you can take as much as you want. And I hear that all the time. We can talk about that at another consult. However, that fat we're going to use not for rejuvenation, but as a rescue. We're going to treat you with some of the most aggressive settings we possibly can. And then we're going to add nano fat. It's your own fat acting as a rescue cream on top of your skin. And then we're going to microneedle that into that area that we just treated aggressively. What that's going to do is deliver stem cells and rejuvenative microtransfers, things that are signalers to tell the body to start healing immediately. It's not adding volume, it's not injecting fat, but it's getting you to heal faster. One of my mentors and one of the, I think the preeminent the plastic surgeons operating on the face and neck in the country, Dr. Brandon Clater up outside of Philadelphia in the main line, pioneered this, the Lamina treatment. We're using it here. We're one of about 3 places in the world that you can get that. But your rejuvenation time is going from 2 weeks to 3 weeks of having crusty, bleeding, scabbing. All of a sudden, at 6 days, you're back in public with a little bit of SPF and tint on, and you're getting a result that looks like this. No offense to Dr. Peck, maybe a little bit better. So I think we have an amazing treatment plan for people coming in with a mouth and neckline and jawline that looks like that. And this is just another, the same exact, different view from the same patient. Moving forward, so special offer. Anyone who attended here, we really appreciate it. I know it's not the perfect time for anyone. It could be, you could choose the time, and it's never a perfect time for you to take an hour to listen to us. However, we appreciate it. Whether this is live, whether you've skipped through this and only listened to about 10 minutes, I appreciate you nonetheless. However, if you guys book within 1 week of the webinar, you're going to receive a complimentary ZO Skin Healthy daily skincare program. About $145 that you normally have to pay to really make sure we're keeping up on that. We're going to include that free for you. And what that really means is that we're bringing you into the fold. We are going to talk to you. We're going to make sure that you hear us, and most importantly, that we hear you. But we're bringing you into this because we're going to do everything we can, and we're going to send you home with an amazing pack that you can do everything you can to make sure that your skin and your body is healing as good as possible. And now every day is part of that healing. And once all the healing's done, you're keeping up with it every day. And we might see you a year later. We might see you 2 or 3 years later because you're not going to need a treatment. But we're always here for you. And we're going to make sure that we give you the best things to keep yourself as healthy and rejuvenated as possible.
I love you. That sounds so great. Thank you so much for going over all of that and for that great presentation. I hope those of you that joined us found it educational. So now let's open up for some questions. So if anyone has questions here, pop them down, and we have a few already ready to go. All right, so you mentioned nanofat. What does that mean?
The nanofat is essentially, we're taking your own fat. Fat cells are amazing because they don't seem like they do a lot. They store fat and store energy, and that's where we thought they ended. In all reality, fat is one of the most rejuvenative things we have in our body. And what we do is we take a little bit of fat from somewhere that's a little stubborn. I love taking it from a stubborn place. So you can point it out and I'll take it from there. The best places are usually the lower abdomen, the flanks over on your kind of the love handles, or the middle, the inner thighs. And what we do with that is we put it through a special treatment that actually bursts the cell walls. So we're not using it as a volumizer. Now, I will tell all of you an inside baseball trick right here. I'm going to give you an unbelievable discount if we're doing this and you need a little bit of rejuvenation under your eyes or on your cheeks or your temples. I'm taking the fat already. I'm going to give you a really good discount to inject that fat to volumize it. We'll take a certain amount and we're going to volumize it. We're going to fill up your temples, your cheeks, your under eyes, right along your jawline. All of those places, I'm more than happy to inject that. But what I really need after this laser treatment is about 20 cc's of your fat to pulverize it. I want to break down all those walls. And what it's giving you is stem cells. And it's giving you all of those signals to tell your body to really heal itself. When we do is we use that as your own natural cream on your face as a rejuvenation or a rescue cream. And then we're going to microneedle that into the areas that we treated. And what that's going to do is jumpstart your immune system to start healing. It's not like PRP. PRP, if you hear that, is going to be a lot more reddening. It's going to make your body create new vascular and blood vessels. You don't need that. You have enough in your face already that makes you red. It keeps you red longer, and you're not going to love it. This fat gets rid of the redness. It's going to give you that really happy glow. And it's going to make sure that you go from 14 days of downtime down to about 5 or 6. And it's an amazing treatment.
Very cool and very unique. I love that. All right. So, can you do UltraClear at the same time as other treatments, say injectables?
Normally, if we are doing filler, we are going to do the laser and then you're going to come back afterwards, just because the laser can make you a little swollen. You don't want to do Botox immediately beforehand because we want to let that set in. We don't want to start moving muscles around. So you can do Botox, a couple weeks later, come see me, do the laser, a few weeks later, come back and do the filler. It's the best course of action that we found.
Now, for other treatments like surgical treatments, we do them at the same time all the time. The second I got the UltraClear in, we called almost every single one of my face lifts, neck lifts, upper lower eyelids, brow lifts, everybody, and said, hey, we got this in, you're already on our schedule. We'll give you a pretty good discount because you're already on the schedule. We're here. We're going to make sure you not have a great result. You're going to have an amazing result by really buffing everything up at the same time. I can do any type of surgery that you want. Dr. Church as well. If you're seeing Dr. Church to get a tummy tuck or a breast augmentation or a breast lift or liposuction or lower body lift, and you go, you know what I also really want? I want to get rid of all this pigmentation and fine lines on my face. You can talk to us about that, and Amy can come into the operating room while you're asleep, while you're numb, and you don't remember any of it. You're already going to be at home for 5 to 7 days and have downtime. We can do it at the same time, and it really increases how happy you are with yourself overall at the end of the result, because you were getting a tummy tuck and all of a sudden your face looks 20 years younger, or your belly looks 20 years younger and your face looks 10 years younger. That's a pretty good wake up, if you ask me.
That sounds really great. All right, so what does the aftercare look like? You talked about not a lot of downtime, but what does it look like while there's some downtime?
So while there is some downtime, we are going to send you home with vinegar soak. So for the first 7 days, for 3 to 5 times per day for 5 to 10 minutes, you're going to do a vinegar soak. It helps to pull the heat out. It also helps prevent any infection. We're making sure you're not sleeping with your pets. You're staying away from pet danger. You're not working out. You're not going to a dirty gym and touching something and then touching your face. You're staying away from alcohol, and then we send you home with a packet of products, post-care products that you're going to use for those 7 days. If you're using a series, there's plenty to get you through those as well. You're going to feel hot immediately afterwards. You're like, I can feel the pulse in my face. That goes away after hours, though. Then you're just hot. But you wake up the next morning, there's no pain, there's no heat. You are just tight. You're probably a little swollen. Day 3 or 4, you're having some heavy sloughing. Day 5, you have that soft baby skin.
And I think most importantly for that, what Amy told you is unbelievably true. It's also unbelievably written down in multiple packets that we give you. It's also labeled on all of the products that we give you. And if you're having surgery with me, you're getting my cell phone number, so you can call and text me anytime you want and go, I have 1, 2, and 3 written down here. Should I really use number 2 after number 1? And I say, absolutely. And you send me a photo and I go, you put the tops on the wrong things, switch the tops back and go back to the original ones. We're here for you, and we're here to make it as easy as possible, but it's not always foolproof. And we're going to make sure that you have as many options and as many resources as possible to get you healed as fast as possible, but with the least amount of stress, because stress is important to limit while you're in your healing phases.
That makes sense. All right, let's see. I think maybe we can fit in one more question before we wrap here. So, well, here's a good one. If I'm interested in UltraClear, what is the next step?
So your next step on this is to call our office. From the front desk people answering your phone calls to the people that are going to schedule you, to me, to Amy, to Leslie, to everybody around here, we've made sure that everybody really understands what we're doing. we do not charge you for a consultation. That's not what we're here to do. We want you to come in and get the best possible information from the best possible people and make sure that we can really give you an individualized treatment plan for what bothers you. What we see doesn't necessarily matter if it doesn't bother you. So call us, you can email us, you can fill out the contact form on our website. And even here, you can get a hold of us and we'll make sure that we get a hold of you, get you in at a time that's convenient for you. And you can talk with Amy. If you think there might be a thing that maybe I need surgery on this, I don't love my upper or lower eyelids, but I want laser too, make a consult to come see me. We'll talk about it from top to bottom. And if you decide that it's not going to be surgery that you need, we'll get you in here to see Amy. We sit down, and this is another question we had otherwise. I do not come up with every single laser plan for all of the patients that are having surgery and getting lasers. Amy does not come up with every single laser plan that she sees that does not need lasers or does not need surgery and is getting an UltraClear treatment in her room. 98% of every patient that gets a treatment, we have sat down and talked about together because we want to make sure we are giving every single option to you and making sure we're addressing all of the little things because both of us use this machine all of the time. We want to make sure that we are giving you, maybe I saw somebody yesterday that I treated that I said, actually, if you put a little bit of numbing medicine right here, no one has pain anymore. Or she'll go, if you actually wait 27 minutes instead of 24, you don't even need to do that. Or I did a second pass instead of a first pass of this, and I love the result of that. We're here as a collaborative unit. We're not here. I'm not just the surgeon that says, do this, do that. She's not the esthetician that says, it's my laser, get out of here. We're here as a collaborative unit to make sure that we're listening to you, we're listening to each other, and giving you an unbelievably individualized plan to make sure that you're as happy as possible.
That sounds great. So I posted in the chat the phone number and a link to our contact form if that is helpful. But please make sure you tell us you saw this webinar so we make sure that we get you your gift. But we do have a name of everyone that was here right now, so we'll keep it in our records. And we really look forward to seeing you all and hopefully treating you with UltraClear or whatever we can to support your needs. And Amy and Dr. Sheck, thank you so much for taking your time out of the busy day. We know you're so busy right now. Everyone wants to get in before the holidays, which reminds me, if anyone wants to try and get this done for a little glow before the holidays, definitely call in the morning, please. I have a feeling we could probably try and squeeze you in, even though we are very booked up. So please do call. And anyways, thank you so much for your time, Amy and Dr. Sheck. Thank you for your time for those of you that joined us. And we look forward to seeing you at Belle Vie Plastic Surgery soon.
All right. See y'all. Thank you so much for coming.